It's an absolutely beautiful day outside, and I went for my 8 kilometer walk with my cat. So I'm feeling really good. I come home. I did go to the thrift store. I got some yarn because I'm making some more dream catchers. So I got a big spool of yarn, and I'm going to make some bohemian dream catchers. It's more of a craft for me because I do finger knitting, and it's good for my agility with my fingers. So I am in my 60s. Think about it, right? So I got some yarn. I walked it there and back nonstop. I walked up quite a few hills, and so I'm feeling really good. I think I need to do some spot, what would you call it, tightening? Yeah, I need to do some spot tightening, but I am feeling healthier. And I do try to, in the warmer weather, I do try to walk daily. And I do try to walk the 8 kilometers daily. But things have changed a little bit in my neighborhood, and so I have to be very careful at what time I walk. I need to walk when I feel that semblance of safety, when the stores are open, things like that, right? So I'm very cautious with that, but I'm trying to find, it's so hard to find anyone to walk with during the day because a lot of people don't want to walk that far. And for me, it works. For me, it helps my my lung capacity. It's starting to tone up my legs and my stomach muscles, so that's good. Although there are some spots that I need to tighten up a little bit more. Anyway, I wanted to kind of get on here and tell you some of the things that I've done. So my hair, I've been taking the B12, and my body is absorbing the B12 really good. Now, in the past years, I was depleting my B12 with smoking and things like that, right? So I've since quit. It's been 8 years, and my hair is growing like crazy. I normally wouldn't have to cut my hair for like 6 weeks. I have to cut it every 2 weeks. Last night, I cut about maybe, like, it had to be a good 3-4 inches off my hair. And because my hair is curly, you don't notice it on these videos, but I did. I cut quite a few inches off my hair last night. I'm trying to get this camera lighting, but it's just, I'm horrible at it. Anyway, so, and when I walk in the summertime, the sun has a tendency to bleach my hair completely white. I do have a little bit of dark left, but it bleaches it completely white. So I'm going to tell you what I did. My hair was long. It was maybe to here, and I want to keep it shoulder length for the summer. So I cut it. And once again, I don't go to the hairdresser. I can't afford it. I can't work it into my budget. So I cut it myself. There is a YouTube channel. It's a hairdresser, and he's got a very high-class clientele. And he taught me on his videos, on everybody can watch it, but I learned how to do the wolf cub cut, right? And he has like the butterfly cut and all types of things. Well, the wolf cub cut works perfect for my texture and my curliness in my hair. So I did that. And I took about 3 inches off. I couldn't believe it. Maybe even 4 inches. There was quite a bit. It was quite long. But I find that my hair gets very unmanageable when it's really long. It gets knotted, and I'm not interested. I like this shortcut because I can do this, and I'm done. Right? I'm done. So I did cut my hair last night, and I went to the library. I'm having a coffee with a shot of virgin olive oil in it. That helps to keep all that fiber moving through the way it's supposed to, instead of kind of getting bound up some places, right? Just letting you know, if you have a tendency to have constipation or any problems with your bowels, take a shot of virgin olive oil, put it in your coffee with a little bit of cinnamon, and I'm telling you, about half an hour, you're going to be working just fine. It's going to unclog all those pipes. You know what I'm saying to you? Okay. So I went to the library, and I got some magazines. I wanted to kind of like redecorate my apartment with what I have, not purchasing anymore, but just to rearrange it. So I got some magazines, and I was thinking greenery would be nice. So I got these magazines. It's called Real Simple. I got 2 of them. And so I was looking through them the other day when I was drinking my coffee, And I found, oh my goodness, I found an article, about the tongue. And you're kind of thinking, oh, girl, you found an article in a plant magazine about the tongue? Yeah, because they were talking about herbs and how to use herbal remedies, okay? And I'm going to tell you a little tidbit about this. I did write some stuff down, but I want to tell you what I remember from the article. So they were talking about Chinese medicine and ancient practices. And did you know that in ancient times they used the tongue to tell if you were having issues in your body? Okay. And the tongue will tell you if you're dehydrated. The tongue will tell you if, I have to put my glasses on for this, if you're dehydrated, if you're using coffee or nicotine, okay, if you're a heavy smoker, your tongue will tell the tale. If you're having problems with your immune health, your tongue will tell the tale. If there's vitamin deficiencies or mineral deficiencies in your body, your tongue will tell the tale, right? So in Chinese medicine, that was like 3,000 years ago. I mean, think about it. A 3,000-year-old discipline was using these type of ancient healing modalities, practices, and they look at the size, the shape, the color, the coating, the texture of the tongue, because they said that the tongue is the gateway to our bodies. Okay, so it will tell the tale. Puncturists, they also use that type of modality, okay, where they look at the tongue and the different things that are taking place with your tongue. And that's how they would tell where your issues are stemming from, okay? AI has been utilized in both Australia and Iraqi by researchers who were using AI to analyze the tongue and images of the tongue from patients with diabetes. So, basically you just take a picture of your tongue, send it to your doctor, and they can literally diagnose you at this point in time. That's how far medicine has gone with this AI modality, okay? Now, what I found interesting, so I can't get this light right. What I found interesting is that some of the things that they were finding with the tongue, I have those issues. Like I have high blood pressure, I have hypertension. And they say, look at your tongue. If your tongue is pink and it has no, markings on it, or it's not swollen, whatever, then you're healthy, right? If it's that nice, bright pink color. Okay, mine's pink. Yeah, mine's pink. It's fine. Right, but if you're unhealthy, underneath your tongue, there's those two veins on the side of that little median, that little vein on the middle, right? If those two veins are swollen, that's a sign of high blood pressure. See those two veins? If those two veins are swollen, that is a sign of high blood pressure. Okay. If you have scallop-like indentations on the side of your tongue, right, on the side of your tongue. And it's almost like, those pie plates that have kind of like the scalloped edges, right? So and I've seen it on some people I know on their tongues. And so that literally points to thyroid problems. It points to anxiety. It points to depression, those type of things, okay? If your tongue is swollen. Okay, if it's red, it's painful, it's fuzzy, that could be a candida infection, a yeast infection. And you don't just get yeast infections for no reason. There usually is something that's taking place in your body. And they have been researching and finding that there is candida fungi in some type of cancer cells. And there is a link, I'll see if I can find it and post it down below, where they were actually talking about researchers have found candida fungi or cells in cervical cancers, ovarian cancers, what was the other one? I think it was throat cancer, those type of things, stomach cancer, okay? So the truth is, you can stick your tongue out at somebody and they can read it. Yeah, so I just thought it was really interesting that there are parts of our body. Our body is talking to us all the time. Our body gives us messages. Our body tells us when we need care in certain areas. I mean, think about it. Doctors look in your eyes. Optometrists look in your eyes. Okay, you can actually read somebody's health by taking a good look at their hands, their tongue, their eyes, those type of things. Even the color of your skin and the texture of your skin will tell you certain things. Certain dynamics will be read by you looking at your body and actually reading the signs that your body is giving you. I mean, it's easy with me to see when I'm dehydrated. My skin will get a yellow color. My skin will get very deep lines, and I've been noticing that lately it's not as bad as it used to be. However, it does take a period of time for this to work, right? So what I do is I take a little bit of Himalayan salt, I put it on tip of my tongue, and then I drink 8 ounces of water. And every time I take 8 ounces of water, I take a little bit of pink Himalayan salt, and I don't mean a whole teaspoon. I mean a little bit on my finger, touch it on my tongue, and then drink that water. Because I was finding that through the years when I was, after I had the heart attack and the strokes, and I was taking certain medications to combat that, and they worked. Don't get me wrong. I listened to the doctors. I did take the medicine that they gave me, and it worked. It really did. And but when I weaned myself off those meds, I found a difference. So some of the medications were literally stopping me from absorbing the iodine. Okay, and that is one way that they combat high blood pressure, is because it could be that salt intake, right? But after I weaned myself off the medications, I found that I needed to focus more on what I was losing in my body, and I wasn't able to absorb my B12. My nails weren't growing. I had deep ridges on my nails. I had, my nails were just like a washboard road. That's what they were like, my nails. And now they're not. And I've been taking B12 now religiously. And before I took it in the capsules, but I have since decided I don't want any plastics. So I've been taking the liquid B12. And I'm telling you, my hair grows like crazy. My nails, I have no ridges on my nails. It's helping with my gingivitis on my bottom 4 teeth. My skin is better, and B12 is for basically your skin, your hair, your teeth, those type of things, right? And I'm telling you, it worked. It really, truthfully worked. So I'm very cautious. If I see an article about something that I don't really delve into, that I don't know a lot about, I will read it and I will make notes and I will possibly do a video about it, because for me, it's easier for me to remember something that I'm learning. And this is strictly about learning and researching and knowing my body and what my body needs. It's not about teaching you. Maybe it's encouraging you to open your eyes and maybe grab a book or two or go on the internet and research things in your life. Like if you're going to your doctor, and I don't have a doctor, so if you do and you're able to go to your doctor and ask them the questions, what I suggest is taking a book and a pencil and writing down a list of questions, and then going to your doctor and asking for an answer. I don't have a doctor. I have to research through books, the library, the internet. I do have a pharmacist that I can ask them anything. And they're even of the mindset that if there's something that I'm trying to find out about a certain medication that I'm taking, or that I'm opting to take, or that I've been suggested to take, they will literally help me pull up that information. And they allow me to have that freedom to make that choice on my own. And that's what I like. That's what I like. So, like I said, this is a learning journey. This is a healing journey. And it's, mind, body, and spirit. So I'm feeling good. I'm feeling positive. Now, I would suggest that you go back and look at the video I made yesterday, I posted yesterday, about the hormone that stress and anxiety and negative thinking will literally create a hormone in your body that literally depletes your white blood cells, which help to fight disease and illness. So I suggest very strongly that you watch that video, and hopefully it opens up your eyes and maybe your ears and maybe your curiosity, and you will research more. Yeah. I would love to have a back and forth conversation with people on my YouTube channel about my health and about the things that I'm finding out, but I can't. I can't do that for the simple reason that this is my healing journey, okay? And I'm not encouraging you. I'm not a doctor, a nurse, a health practitioner, nothing. It's just me. And I'm not encouraging you to follow my lead, okay? I'm encouraging you to open up your mind and to be curious about your body and to learn about your body. That's all. I'm not encouraging you to go off your medication if it works for you, okay? But I am asking you to open up your mind and research. Take that list of questions into your doctor and sit down with your doctor and say, this is happening or this is happening. I mean, you wouldn't give your pet, your cat, and I have a cat, you wouldn't give your cat calcium, would you? That's a human medication. You wouldn't give your cat calcium unless it was geared for your cat, right? And if your cat didn't need it, would you give it to him? If your cat was living their life and they were happy and content and purring and they weren't showing any sign of sickness, okay, throughout their whole life, okay, would you then create some type of illness and say, well, I think that my cat needs this type of medicine. My cat is listless. My cat can't focus. I need to give my cat some medication so they can focus. Hell no, right? You wouldn't give your cat something that they don't need. So why would you do that to yourself, right? And whether it be holistic or whether it be pharmaceutical, okay? Go talk to a professional. Talk to a doctor, okay? But listen to your body too. Don't go and ask your doctor for medication that your body's not telling you it needs. Okay? Just be aware of that. That's all I'm saying. So I found this interesting about the tongue because it's been in practice for 3,000 years. And acupuncturists, they use it. Chinese herbal doctors, they use it. Holistic practitioners, they use it. They look at every aspect of your body. It's literally, they're asking questions of your body and your body's answering them. So, maybe you should listen up a little bit more. When you look in that mirror, listen to the person that's looking back at you, because you'll find out all sorts of things that maybe you didn't know before. So, anyway, I shall see you in the next video. Enjoy this. I mean, I'm finding out things that kind of blow me away. I mean, I had no idea that you could look at someone's tongue and tell them they had thyroid problems. Like, seriously. And I've seen those little scallops on people's tongues, and I didn't know what it was. Had no idea. But now I do. So I shall see you on the next video. The good Lord be willing. And I'm going to fix I'm going to warm this up a little bit, I think, because when it gets cold, it gets a little bit weird tasting. So I'm going to put a little bit more cinnamon in it, and I'm going to finish this, and then I'm going to do some exercises. I am going to go back to do some more sit-ups and 50 more push-ups on the wall. So I shall see you in the next video. The good Lord be willing. Namaste. Bye-bye.